presentation, there will be a question and answer session. To ask a question,
thank you for joining us for the COVID-19 media briefing call for May 26th. We'll start today with opening comments from MDH Infectious Disease Director Chris Ayersman and COVID-19 Vaccine Equity Director Dr. Nathan Challawal. After their opening comments, we'll take questions. With that, I'll now turn it over to Chris Ayersman.
Thank you, Mike. I'll start with the global and national update. As of this morning, globally, we were above 167.8 million cases, up 528,599 from yesterday, and over 3.48 million deaths worldwide, an increase of 12,330. In the United States today, we have had more than 33.1 million cases of COVID. That's up 22,780 cases from yesterday, and 590,950 deaths in the U.S., an increase of 376 from yesterday. In Minnesota, we reported 438 new cases today, and our new total is 599,909 cases since the start of the pandemic. We expect to cross the 600,000 case mark tomorrow. It's hard to fathom that so many of our family, friends, and neighbors have been impacted by COVID-19. It's a stark reminder of the importance of staying vigilant because this virus has not gone away. Get vaccinated when you can and keep taking steps to slow the spread of COVID-19 so we can prevent as many new cases as possible. Minnesota had 12 COVID-19 deaths reported today, so we are at 7,393 deaths since the start of the pandemic. There are 364 people currently in Minnesota hospitals with COVID-19. Of those, 90 are in intensive care. And since the start of the pandemic, there have been a total of 31,947 patients hospitalized and 6,474 people received intensive care. A little bit more positive note, let's talk about vaccine administration. More than 5.18 million total vaccine doses have been administered to Minnesotans at last report. This includes both first and second doses. Of the population aged 12 and older, 61% have received at least one vaccine dose. Of people 16 and older, 64% have received at least one dose. And of the population 65 and older, 89% have received at least one dose. If we look at a completed vaccine series, and we look at people 12 and older, 54% of Minnesotans 12 and older have completed their vaccination series. When we move to 16 and older, it's 57% that have completed the vaccination series. And if we look at people 65 and older, it's 86%. So we're making progress in our vaccination, but we certainly still have a ways to go with our population under 65. Then I just want to take a minute to remind people of the State Fair vaccination site. This site is in its final 2 weeks of operation. For the last 2 weeks, so May 26th through June 8th, they're offering the single-dose Johnson & Johnson vaccine. This is a great no-cost option for anyone over age 18 who has not gotten vaccinated yet. And it's a once and done. There are many great features at the site to make it convenient and accessible for Minnesotans. There are drive-through lanes, translators on site, and convenient access from public transit, to name just a few. There are plenty of appointments available, and walk-ins are also welcome. To sign up for an appointment online or to get more information, visit mn.gov/COVID-19/vaccine and click on the State Fair vaccination box. Don't miss the opportunity to get vaccinated before summer, whether it's at the state fair site or another local opportunity near you. The more people who get vaccinated, the more we will reduce the spread of COVID-19 and be able to do more of the things we love with the people that we miss. And with that, I'll turn it over to Dr. Challawal.
Thank you, Director Ayersman. As part of my weekly updates going forward, I will be summarizing Minnesota's vaccination data by race and ethnicity. I'll remind you that the way this data is reported lags by 1 week. As of May 15th, vaccine coverage with at least one dose increased at the greatest rate among Minnesotans identifying as American Indian, increasing 14%, resulting in overall first dose coverage rates of 42.9% for American Indians age 16 plus. Overall first dose vaccine coverage among ages 16 plus remains highest among Asian Pacific Islander Minnesotans, with 62.8% having had at least one dose, followed by white Minnesotans at 59%, Hispanic Minnesotans at 44.4%, and Black Minnesotans at 41.8%. Though Asian Pacific Islander Minnesotans have the highest first dose coverage, white Minnesotans have the highest coverage by completed series, indicating that the increase in coverage amongst Asian Pacific Islander communities is relatively recent. And we also recognize that broad racial categories like Asian Pacific Islander often mask communities and the disparities they are facing in response to COVID-19. We are continuing to work to find ways to provide more disaggregated data where possible. Regarding our place-based equity metric using the Social Vulnerability Index, or SVI, over the last week, cases, hospitalizations, and deaths remain overrepresented in Minnesotans who live in zip codes classified as high SVI zip codes, areas where communities are at a disadvantage due to historical and persistent underinvestment. Though residents of high SVI zip codes make up 29% of Minnesota's population, they make up 32% of cases, 39% of hospitalizations, and 38% of deaths due to COVID-19 as of this week. Similar to the overall population, the impact has been greatest among children who live in high-risk SVI zip codes, with children younger than age 17 who live in high SVI zip codes in Minnesota experiencing 42% of all COVID-19 hospitalizations to date in their age group. When looking at vaccine coverage by SVI zip code quartile, coverage remains lowest among Minnesotans living in high SVI zip codes. Statewide vaccine coverage is at 64% by first dose for 16 plus, while 61.1% of Minnesotans living in high SVI zip codes have had their first dose, compared to 70.6% of Minnesotans living in low SVI zip codes. Since setting our equity allocation goal, we have seen a decrease in the gap of first dose coverage between Minnesotans living in high SVI zip codes and the statewide average. And while we still have a ways to go, this notable progress is in large part due to an incredible amount of work that has gone into supporting community vaccination events. The Minnesota Department of Health, local health departments, vaccine providers, and community partners are working together to provide local community vaccination opportunities. These events often bring vaccines to people who would otherwise have had a hard time getting vaccinated. Over the next 2 weeks, MDH and its partners have 107 known community vaccination events planned around the state. Our data from our FEMA-supported community clinics the last 6 weeks further reinforce this as a critical strategy in addressing our racial inequities in vaccination coverage. Among Minnesotans who identified a race and were vaccinated at our FEMA-supported community clinics the last 6 weeks, 26% identified as Asian, 26% Hispanic, 16.5% Black, and 24% as white. This is a notable increase in our ability to connect Black, Hispanic, and Asian communities in particular with COVID-19 vaccines. MDH wants to continue to support communities' access to COVID-19 vaccination events and encourages community-based organizations to consider hosting a vaccination event. Last week, we posted a new webpage where interested groups and organizations can complete a community vaccination event request form, understand what roles and responsibilities hosting an event entails, and learn about limited funding that will be available to support costs for community groups selected to partner on community vaccination events, with up to $5,000 potentially available for community partners for each event. Priority will be given to events that aim to serve under-resourced communities in high SVI zip code areas and those working with Black, Hispanic, American Indian, Asian Pacific Islander, and other focus communities like Minnesotans with disabilities, Minnesotans who are unstably housed, and those in the LGBTQ community. You can find this info on MDH's website. Just go to health.state.mn.us and search host a vaccination event. And with that, I'll turn it back to you, Mike.
Thank you, Dr. Challawal. Operator, we're ready to take questions.
Thank you. As a reminder, to ask a question, you will need to press *1 on your telephone keypad, and to withdraw your question, press the # key. First question comes from the line of Jeremy Alton from Star Tribune. Your line is now open. You may ask your question.
Hi, I wanted to ask about a CDC MMWR report last week looking at vaccination rates across states. And Minnesota, interestingly, was better than the nation, but in one area, our fringe suburbs surrounding the Twin Cities, our suburban vaccination rates were lower, and those are areas that don't necessarily correspond to socially vulnerable index, high SVI levels. So I was wondering if any of our strategies are pointed at those suburban counties where our vaccination rates have been so low.
Dr. Chimillo, do you want to take that one?
Yeah, sure, Chris. So looking at different communities, there's different issues that drive vaccination rates. And so our SVI metric in particular is really aimed at identifying communities that have both historically and that we're seeing currently have issues in access to the vaccine for a number of reasons. And so you're correct in that it doesn't capture some of the reasons in those communities where it might be more need of information, and there's some vaccine deliberation going on where we need to be targeting information through trusted messengers. And so as part of our overall campaign to continue work with our different community groups that we've worked with throughout the pandemic, we're trying to continue to get messages into communities, whether it's through faith-based leaders, community organizations, businesses and employers, to help folks meet the need to understand the risks, benefits, and rewards of getting vaccinated. Speaking to those areas specifically, I think there is some hope that work on our incentives program that will also address some of the vaccination lags that we see there so far. And so I think there's a number of things, both kind of working towards access, which access is toward the vaccine, but also looking at access of information in that area to try to help drive some of the gaps we see there too.
And Doctor, thanks for teeing me up on my follow-up question regarding incentives. There's been some discussion of whether the governor and state leaders will roll out some financial gift card or other incentives to kind of nudge people along. I wanted to get either of your thoughts on those as strategies, whether there's any ethical concerns, but also if you think they're going to work, if they have potential to kind of push people who have been hesitant so far.
Jeremy, this is Chris. I'll start. First of all, I'll acknowledge that at this point, the level of detail that we can give is just, as the governor said, we are looking at options that might help, people consider getting vaccinated. And we don't have any more details on specifics at this point, so I'll just acknowledge that up front. And then, incentives are a tool that we use in public health on a regular basis. They have been identified as an evidence-based tool to help people make a public health decision. They are generally the incentives that are given are of enough value that it is of value to the individual, but are intended to be of small enough value that they would not be considered coercion, because it's important that people are making their own decisions. So we really look at incentives as sort of a nudge to get people to move in the right direction. But I do want to acknowledge that this is a tool that we have used. We've used it with completion of therapy for tuberculosis, for encouraging people to get tested when we've had outbreaks of HIV or syphilis. So it is a well-known and evidence-based public health tool that we use and have used. But to your question about the ethics of it, it's important that the monetary value is such that it gives people that nudge, but is not significant enough to cause sort of, as you said, an ethical concern. I'll ask Dr. Camillo if he wants to add something to that.
Yeah, thanks, Director Ayersman. You covered the ethics part well, and so I won't add much more there, and just add on to the evidence base that we have in incentives being used in other parts of primary care. And so we've seen incentives used to encourage well-child checks, for example, getting your hemoglobin or lead screening for children. We've seen it used to encourage cancer screenings. And so it is something that has been effective at helping folks get preventative care in other parts of our healthcare system and delivery. And so the hope would be we would see the same impact here, and again, both for the individual's benefit, but for the community's benefit as well.
Thank you.
Thank you. We have the next question comes from the line of Bill Werner from Minnesota News Network. Your line is now open. You may ask a question.
Thank you. Chris, I want to ask you, first of all, how are we doing in terms of, I know that the progress on vaccination rates had slowed somewhat, but that it seemed like we were doing a little bit better. Can you give us some sort of a picture on where we're headed in that area? And secondly, some advice and tips from folks going into this holiday weekend, what is allowed, but beyond that, what you might suggest people would be prudent just to keep people safe. Thank you.
Sure. So when we look at vaccination, yes, we've definitely, earlier in the year, you would hear our daily change in vaccination coverage going up by a percentage point or two every day. And we've shifted to having a strategy that is much more targeted and much more community focused. So yes, we're finishing up the state fair site, but not as many ultra large sites, but smaller, more targeted vaccination. And so as a result, we're getting people vaccinated, but not at the same volume that we have in the past. So each day, we're seeing increases in vaccination, but now we're looking at, a 1/10 of a percentage point or 2/10 of a percentage point. And that is still something to celebrate. And we are making progress. I think, I have to say, I have to give props to our elder population. When we look at our 65 plus population, 89.3% have had a dose and 86.2% have completed the series. So that's really significant. And when we look at, overall our 16 plus population, we are at, 63.7% have had one dose and 57.2% have had two doses. Now, President Biden set a goal of 70% of 18 plus by July 1st. And when we look at that goal, we're at 64.4% that have had that first dose that he's looking for. So, we're making progress. It's a little bit slower. I think the things that when I look at the data, the things that strike me are, first of all, our adolescents 12 to 15 have been amazing. They just had the opportunity to get vaccinated a bit over a week ago, and we're at 21.5% of that population has already received vaccine. The 16 to 17-year-old population, 42% of that population has been vaccinated. The 18 to 49, so really the heart of our working population, we're at 53.1% of that population. So we definitely have a ways to go with some of those younger populations. And with our 50 to 64-year-olds, we are at 68.7%. So there's definitely, very encouraging news with our vaccination coverage. We're moving forward. We're just moving forward at a slower pace than we were before, in part because our focus is much more targeted, and we're looking at smaller events, bringing things closer to home. And that's why I think considering incentives is an important thing too, to kind of nudge people in the right direction. In terms of the weekend, just a couple things. If you're fully vaccinated and your family members are fully vaccinated, you can really enjoy being together. Obviously, outdoors for everyone is just a safer setting in terms of COVID. If you are not vaccinated, you want to be masking and socially distancing, keeping that in mind. And consider that anytime you're getting together with a large group of people, in particular indoors, but anytime you're getting together with a large group of people, that increases, your risk for acquiring COVID. And while our case numbers have, slowed down a bit, we are still seeing transmission. And so, people still need to be thoughtful about those things. But I think, if you're fully vaccinated, really kind of revel in that and have a great weekend with the rest of your family that's fully vaccinated. If you're not vaccinated, consider getting vaccinated as one of the things you plan to do over the weekend. You can go to the state fair and be done with it. But then also, keep in mind that gathering together in a large group is really the concerning thing. When it comes to executive orders, as of the 28th, all of the executive orders that have to do with capacity limits and those kinds of things will be done. And so once again, I think if you're not vaccinated, you want to be thoughtful about the fact that there's going to be more people in those indoor settings. So keep that in mind. And then I always want to, say that it's never wrong to mask. And even as the mask mandate has been lifted, as a legal requirement, that there are still many people who will continue to mask because of perhaps an underlying health condition or other concerns, and it's always okay to mask. So just want to reinforce that, and hopefully that answered your question.
Yeah, thanks for being so thorough on that. I really appreciate it, Chris. Thank you.
Thank you. Next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is now open. You may ask a question.
Yeah, sure. So going back to vaccination rates, if I'm correct, looking at the vaccine dashboard, it looks like there's been progress made in getting older people in communities of color, particularly the Black community and among Hispanics, vaccinated. But the younger people, like 15 to 44, still lag in these groups. I'm just wondering what you make of that difference, vaccination rates among younger members of communities of color versus vaccination rates among older members of those same communities. What accounts for that gap, I guess?
Sure. Well, and Kat, I'll start just with a comment, and then obviously we'll have Dr. Chimillo give the full comment. But I do want to acknowledge that we are seeing that difference across the whole state. So in other words, we see that our 18 to 49 age group, we're seeing, a lower uptake at this point in that age group across the state as compared to, say, our elder population. So just to acknowledge that is a hurdle that we have to address for all of our populations. And I'll let Dr. Chimillo comment specifically about our populations of focus.
Yeah, thanks, Director Ayersman, and thanks for the question, Catherine. I think there's a number of things that contribute to some of these gaps one is that they've just many of these communities have had less time to get the vaccine, and so eligibility, opened up for everyone back in the end of March, but not everyone was as attuned to the different changes in eligibility when it came to vaccination, and so I remember having conversations with young parents in my practice who in the end of March and April, I was letting them know that it was now open to everyone, and that was the first time they were hearing about it, because I think some folks had kind of assumed that they heard May as the time for when most folks would be, most adults would be eligible, and they've kind of were kind of planning on that, and we're actively seeking out and weren't as tuned in as other communities as I think. So I think that's one thing. I think certainly the access issues are definitely ones we see more, and we've talked about this in other aspects of the disparities we see, whether it's being able to take time off of work and go get your shot, or concerned about side effects and then potentially missing work, and then having to deal with your employer from that perspective. I think holding your kids out of school if they finally got back into school, and then you're worried that if you're 16 or 17 got a shot and then had side effects, and so now maybe you're waiting until the summer to get them their shot. And so I think there's a number of just other variables that our communities who have faced structural inequity in access to the vaccine are having to weigh, and that contributes to it. I think again, information, and just there's a lot of misinformation out there that gets into our communities at different rates, and so having consistent ways to get information from trusted messengers from those, not only those communities just broadly, but then looking at more specifically at different messengers within different age groups and ranges. And so I think that those are things and efforts that are underway, but I think the messaging was more broad initially, and now is getting more focused about some of the efforts I've seen different organizations do. So I think there's a number of reasons that can explain it, and things that we're aware of and working on, and then we're looking at forward into the month coming up, getting into community again more, and continue to hear other ways that the department can help get the message out and get the vaccine out.
And Chris, just to follow up, when you say we're seeing that kind of generally, I mean, is this evidence of younger people just not feeling like they need it, or would you say it's more like a convenience thing, like I gotta work, I gotta take my kids to to stuff after school, I just don't have time? Like, how would you explain it, just sort of for the general population?
Well, I think it's probably a combination. So we're seeing that our elder population has the highest vaccine coverage rates, and part of that is because we brought vaccines to them in some situations. Part of it is because they knew that they were at very, very high risk because of their age. When we look at even the 50 to 64 population, we see just a little bit higher coverage rate. I think it's probably a combination of recognizing the role that age plays in risk, but then it also may be knowing that you have underlying health conditions, that type of thing. And when we get to the 18 to 49 population, I think it's both that sense that, oh, I'm younger, I don't need to worry, which isn't necessarily accurate. We've seen cases in all age groups, and we certainly have seen that in the last month, the percent of cases in these younger groups who are hospitalized has increased. But I think it's probably a self-perception, and then I do think that in that age group, that's kind of a peak time for busyness, both with work, with family, with all of those expectations that people have on them. And so again, I think that's why it's really important that our efforts are focused on bringing vaccine closer to people. If you've got to get between, sporting events with your kids, the grocery store, your job, and squeeze in a vaccine, you want it to be as close as possible. You don't want to have to drive an hour to get somewhere. So that's why, the fact that the fair site has drive-through option, all those things make a difference. So I think that really for the 18 to 49 population, it's a combination of things, which makes perfect sense. But we just want to kind of move people beyond that inertia and get them vaccinated.
Okay, thank you.
Operator, we have time for one more question.
Thank you. Last question comes from the line of Jeremy Olson from Star Tribune. Your line is now open. You may ask your question.
Piggybacking on that a little bit, there was a lawsuit filed by a group of doctors, including Scott Jensen, the Minnesota doctor, former legislator and governor candidate, basically arguing that because of the nature of the EUA under which these vaccines exist, that it's unethical to give these vaccines to children and that it should be prohibited from giving the vaccines to children. I just wanted to get your take on that. It certainly is unusual to have a vaccine given to children under an EUA rather than full formal approval. Does that raise any concerns for you? And if not, what's your response to this lawsuit?
I'm assuming that the lawsuit is filed against perhaps the Food and Drug Administration.
Yes, not against you, but it's just I'm talking about the general allegations in the suit. Yes.
Well, that's good to know, Jeremy. Thank you. I'm glad it's not against us. But
yes.
No, I mean, I think that to be serious about this, I mean, we do take very seriously vaccines that are given to children. And so I think, I want to acknowledge that when the vaccine was first licensed, it was for adults. It was specifically, the vaccines were licensed for adults. And it wasn't until there were specific clinical trials evaluating the effectiveness in children that the vaccine was approved for use in children. And it's gradual. So, we've added the 12 to 15-year-old age group. We haven't started with young children yet. That hasn't happened. So I think there's a very cautious approach that's being taken in terms of, how this vaccine is being evaluated for its use in children. There are the same safety expectations. We've talked about how, yes, the vaccine was made available more quickly, but the same safety expectations have been met, and that's true for the vaccines that are available for children as well. And the expectation is that these vaccines will be licensed in the not too distant future. It sounded like Pfizer was looking at submitting for licensure, in the fall. So I think that, I feel good about I will admit that my children are grown, but at this point, so they got vaccines in the 18 plus age, but I would feel very comfortable having my kids vaccinated. I'm encouraging my nephews to get vaccinated. I, have nephews that are younger than 18. So I feel very comfortable about the vaccines, but just want to acknowledge that there's been a very thoughtful process in terms of rolling out the vaccines and looking at their safety in the younger populations. And Dr. Chamillo has younger kids, so I will let him also comment related to his viewpoint.
Yeah, and I'm a pediatrician. And so I just want to be clear that COVID-19 does impact our children. And I think the narrative out there that it's just a mild cold for all kids and nothing to be worried about is one that can perpetuate harm and risk to our children. I've shared in other places that I have teens in my practice who got COVID-19, had a mild case, but months later, we're still struggling to get back to their normal activities. And we are still learning about the virus itself and its impact on one's health short-term and long-term. And when we think about kids, we want all of our kids and our teenagers to grow up to be healthy adults. And so why wouldn't we protect them from something that could, A, potentially harm their health short term, B, potentially harm their health long term, and C, something that they could get exposed to as adults and then potentially have worse outcomes in their health. And so I'm not familiar with the lawsuit or the claims that it brings forward, but I am familiar with the impact that COVID-19 has had on our children across the country, nearly 3 million cases, 15,000 hospitalizations, over 200 deaths of children due to COVID-19. And that is with a lot of public health mitigation measures. I think folks want to compare it to the flu and other things, but we don't shut down schools and have distancing and all these masking and all these other measures for the flu. So it's a false comparison to try to look at the impact year over year of what COVID-19 has done, despite all those measures, with what flu does on an annual basis. And so as we're looking to open things up, our children still aren't protected, and we want to be able to offer them that protection when the studies have shown that's safe and effective. And I would also want to point out that vaccination for our children is something that we do routinely in many other instances, and that the science behind it, like Dr. Ayersman has pointed out, is very sound. It's followed those sound principles. I plan on vaccinating my toddler once the studies come back and they show the data that may be similar to, or if the data, I should say, is similar to what we've seen with our teens. And if I had a teenager, I would have them first in line to get vaccinated at this point. And so, again, just want to push back against this idea that our children aren't harmed by COVID. Children are part of our communities, and if we want to get our overall society out of the pandemic, it's important to get everyone vaccinated so the virus doesn't have a reservoir to go to. And then lastly, I will just point out something I often talk about as a policymaker and a pediatrician is that children aren't, raised in isolation. They really rely on their caregivers. Their caregivers could be adults who are at risk for COVID-19. They could be their grandparents, elderly. And so it's important that we get out of this pandemic and that the risk is decreased for their caregivers as well, because if they continue to get burdened by the disease of COVID-19 because we haven't gotten the vaccination rates up across our society, that's going to impact our children's health and well-being as well.
Thank you.
All right, that is all the time we have for today. If you have any additional questions, please feel free to reach out to our office this afternoon. Have a good day, and we will